Hi, I'm Jen Gordon, and I have EGPA, a form of ANCA-associated vasculitis.
And I'm Mitch Horowitz. I have MPA, and I'm a registered pharmacist.
We're here today to talk about things to help when you're prescribed medications for vasculitis. Medication side effects. What side effects are possible and how to manage them? Mitch, you're a pharmacist as well as someone living with vasculitis. Let's talk about side effects.
Okay. Side effects are undesirable effects that a drug may have on you. And they are probably unexpected, but they may already have occurred in a large patient population, and you are advised to be aware this could happen. They can be mild, they can be severe, they can be tolerable, they can be intolerable. And how to categorize them is really something you should discuss with your physician in advance of starting the medication.
Tell us more, please, Mitch.
Okay, so sometimes doctors prescribe medications knowing you're going to get side effects. Basically, every drug has them. Some are just so mild you don't notice them, and some could be strong enough to make you have to stop taking the medication and never try it again, possibly even put you in the hospital. So you don't want to let that situation get out of hand. And that's why it's always strongly advised that if something happens that you feel is not your normal, it might be affecting your ability to do your daily activities. Say you get very drowsy, you can't drive, you're actually afraid you're going to stumble on the stairs, something like that. That's the kind of thing that you could be pretty sure your physician wants to know about. Sometimes you might just get a little dizzy standing up too fast from a chair. You would probably have been warned that's going to happen. You're expecting it. If it doesn't make you fall on the floor, take a deep breath and you know to get up slower next time. But you let your physician know that that is happening. But it's probably not going to mean you have to change medications. Also, you can take medications to treat certain side effects. And it's interesting that those medications may have side effects too. So basically, you're looking for changes, things that are happening to you that are different than before you started to take the medication.
So you're saying you can get side effects from medications you're taking for side effects, which unfortunately,
it's unfortunate.
I think some of us have been there. Yeah.
Right. I had a teacher who always described medications as a double-edged sword. And there's a good thing that's going to happen, and something, I hesitate to use the word bad, but we'll just call it a side effect, could happen, but again, it may not be a problem at all. You'll only know it when it happens. So some side effects are sleep issues. Prednisone, big example of that. I know people who can't fall asleep. Also, prednisone can upset your stomach. Your blood pressure may be affected, and it's interesting that the same drug might raise your blood pressure, might lower your blood pressure. So you may want to keep closer track. Almost everybody has the blood pressure machines at home now. If you don't have any issues, it could bring on an issue, so you want to be careful. Ask your physician whether your blood pressure needs to be monitored at all, or if you're already monitoring it, more closely. And then there's a condition called peripheral neuropathy. So that's kind of a tingling, numb feeling sometimes in your fingertips and possibly in your feet. So that can be problematic. Again, how bad is the problem? You tell your physician, I can't write, I can't hold a pen, I can't button my shirt. They may ask you to power through that. They may say to you, well, let's change your medication. It depends on your ability to tolerate something like that. But don't think that I just have to live through this. Sometimes it's better to change medications than to suffer side effects. Sometimes drowsiness, dizziness, these things can affect your entire day.
Yeah, I think that's an important point. You know, if it really isn't something that you can power through, you need to make sure you're communicating that to your doctor.
Yeah, so one of the things is you want to be sure whether the changes you're feeling are from this new medication you started, or is your disease progressing? So the best advice I can give is read up on both vasculitis, whatever form you have, and the new medication that you get, and try to recognize what side effect or symptom you're having. And if it falls into the side effect category of the drug, or you think that your vasculitis is getting worse. And again, we say this all the time, call the physician with this information, because if it's not a side effect and your vasculitis is progressing, your physician may need to change the medication or add another one.
Call the doctor. Yes. Anything else to add, Mitch?
Yeah,
That
I
was a
think
lot of
that's,
information.
yeah, I think
Lot of
that's
good
what has come to me right now.
Thank you. Thank you very much, Mitch.